welcome in. How are you today? You're here for an appointment, and your appointment starts at 1. Okay. Name? Date of birth? Doctor you're seeing? Okay. I am the physician's assistant, so I'm going to be the one that checks you in, listens to your heart, kind of jots down some information to give to the doctor so they have a better understanding when they come in of what you're here for. So we're going to start by doing your blood pressure. Yeah, you don't have to do anything crazy. You can just relax with me. Yeah, we still do it the old school way around here. I'm just going to put that around your arm. I'm going to hold my handy dandy. Okay. Just going to watch that. All right. And just relax for me. Can I see your arm? I'm just gonna do it. Okay, so that part's done. Okay, so I've got that taken care of. I'm just gonna listen to your heart, and then we will talk about why you're here and get all that stuff done. Okay. All right. So take a deep breath for me. Okay, and again. And again. And again. Okay, and just breathe normal. Okay, and again. And again. And again. Okay. Everything sounds pretty normal. Equal breath sounds on each side. Okay, so I'm just gonna jot down your information really quick, and then I'm gonna ask you a couple questions, and then the doctor will come in to see you. Okay. Do you take any medication? Okay. And when was the last time you were to the doctor for just a general checkup? Okay, and then why are you here? Okay, so, I jotted down all your information. I got some of your information on my, board here, and the doctor is going to come in about probably 5-10 minutes, so we'll be right back. Okay. Hi, I'm Dr. Sun. How are you today? I was reading over your chart, and I see that you said you found a lump on your breast. When's the last time that you had just a general checkup? And I was reading that you're 30. Okay. Typically we don't start doing, you know, breast exams through the mammogram until you're about 40. But that doesn't mean that we don't sometimes, you know, see reasoning to need to do them sooner. So what we're going to do is we're going to do the exam, and if I feel that, you know, I feel that there's a lump there, or you need further testing, or even a biopsy, we can do the biopsy in the office. I can give you a shot to numb the area, and then we'll do the biopsy. But first we're going to start off with an exam. My physician, I see that she told you to put on your gown. So I'm going to come in a little close. And I'm gonna start off, and if at any point you get uncomfortable, just let me know, okay? So here we go. Okay, I'm gonna switch to the other side. Okay, I'm gonna go back to the left side. Okay, I kind of feel it. It's kind of, you know, not big, but it's hard. It's not a soft spot. It's like a big, it almost feels like a big ball of tissue. Okay, I'm gonna come in with my light, and I'm gonna get real close and kind of see if I can see what it is. And again, if you get uncomfortable, just let me know. I'm gonna do some pressing, and you tell me if it hurts. That hurts? Okay, we're just gonna look at it and see if I can see what this is. Okay, so I see it, and I don't have a whole lot of concern. I think it just might be a fatty tissue. So what we're gonna do is I'm gonna give you a shot to numb you up, and we're gonna take a sample. Yeah, we're gonna take a sample, and I'm gonna send that off to the lab, and you'll get the results in a couple of days. Sometimes we can get them back faster than a couple of days, but for the most part, it takes about a week to get the results. If you hear from me sooner than a week, then you know that there's concern. But if you don't hear from me within the first week, well, then I wouldn't worry about anything. But don't see any of my gloves, so I'm gonna put my hand sanitizer on, and I'm gonna go. We're gonna get started, okay? All right, so put my hand sanitizer on. Okay. All right. I'm gonna get this started. All right, we're gonna go in right on that spot where it hurts. And we're gonna do probably 5 pokes. Okay, are you ready? Okay, here we go. that's it. And I'm gonna start, you know, documenting your paperwork and kind of letting that sink in. It shouldn't take very long, and then we'll get started, okay? So I'm gonna jot down a couple things. I'm gonna grab one more thing out of here. That way we can get you, kind of get this biopsy going, and you know, then kind of get you on your way. Yeah, I'll gotta grab a couple more things. I'm gonna do one more press to see if the area is okay before I go in, because I want you to be completely numb and comfortable, and you know, I don't want you to feel anything, because it's probably gonna hurt. I have to go back in with the needle to, you know, access the area. We're gonna put a little bit of numbing cream on, you know, just because we want to make sure that you're not, you know, you're extra protected and you're not going to get hurt. We don't want you to come here and be hurt. So give me 1 second. Put this back in here. Close this up for now. Okay, so I'm going to take my tongue depressor, and I'm going to put a little bit of numbing cream on it, and I'm going to press it on, and we will then insert the needle, and then after we insert the needle, I will then take my pliers, my tweezers, I mean. I'll take my tweezers, and we'll kind of, and just pull out a sample, send that sample off to the lab, and then we'll get started, okay? It's gonna be a little painful, but you'll be okay. I promise. We're gonna take care of you here at Sun Doctor, okay? All right, so I'm gonna come in with the light. I know. All right, we're just gonna press this down first. If you feel any pain, you please let me know, because you should not. Like I said, here comes I mean, you shouldn't feel any pain. At the very least, you might feel discomfort, but no pain. Okay. Just gonna get this ready here. All right, this is the unfun part, okay? All right. Inserting the needle now. Okay. All right, needle's in. I'm gonna take my tweezers and pull a sample out. Pushing morphine. got the sample. Now I'm gonna patch you up really good. Clean up. Okay. Get your tape. Cut your tape. Okay. Put some Neosporin on it. Okay. And the last touch, some saline. Okay. Now, I'm going to give you a pain medicine. It should not, you shouldn't feel any pain for about maybe 2 hours, and then after that, all the medicine that we just gave you will wear off. No driving, so I hope you have a driver like they were told, but we're going to give you this medicine, and then we're going to send you on your way, okay? All right, you ready? So I'm going to prescribe you some pain medication that I want you to take twice a day. And then in 2 weeks, I want to see you back. And by then, we should have the results. And if you hear from me, it was probably not good news. But if you don't hear from me, then you have nothing to worry about. All right, I'm just going to jot this down, and then you'll be good to go. As a joy, it's always nice seeing you, so we'll see you in 2 weeks, and keep your eye out for the portal.